everybody! Hello everyone! Hello sa ating mga mommies who are watching. Ako po si Lara Quigaman-Alcaraz, mommy of 2, pero soon to be mommy of 3. Malapit na. And I am very, very excited to be with all of you today. Welcome to the Nutricia Begin Ready webinar. At ang topic natin for today is Ready from Pregnancy to Mommy. Para yan sa ating mga soon-to-be mommies like me, and of course to all the mommies in general who are navigating this new normal. Pero syempre, kailangan may kasama tayo na kausap this afternoon. Kaya kasama natin ang very, very beautiful Dr. Maria Cecilia Reyes, OB-GYN, who will guide us through this topic. Hello, Dr. Ces! How are you?
Hi, Lara. Hello to all the mommies to be. Hi, I'm Dr. Cecilia Reyes, and would like to thank you for having me here. It's such a beautiful day to have a chat with Lara, and I hope you'll get to learn more about pregnancy, nutrition, and how it affects you and your baby. How are you, Lara?
Okay naman, Doc. Malapit na 36 weeks na ako. So,
Oh my.
Another boy. So, I'll be having 3 boys.
So cute. So you want another one? A girl sana next time.
Madami, Doc. Mga 12, ganyan. Pero yung asawa ko, medyo namumblema na siya. Nagka-calculate na siya sa mga gastusin. Kaya baka hanggang 3 lang kami. Pero syempre, di ba? We don't know. Baka bigyan tayo ni Lord ng isa pa. We'll see.
Pregnancy is a very long, proactive process. It begins early in life. It even starts during conception, even before conception, during the 9-month pregnancy, birth, and even after delivery. The 6 weeks that covers the postpartum period is very essential. But of course, to all my patients, and of course, Lara, it's all so worth it. That's why today, I also want to talk about how mothers can #begin ready before, during, and after their pregnancy. How about you, Lara? When you knew you were pregnant, how did you get ready for the pregnancy?
Well, kailangan talaga healthy eating all the time, di ba? Kailangan lifestyle. Pero may times na, you get carried away. Pero every time I find out I'm pregnant, talagang, I make sure na maayos na yung kakainin ko. Minsan nagre-research pa ako bago ko, bilhan or lutuin, pwede ba to sa buntis? Ganyan. So, yung ganon. So, in that way, in terms of my eating, syempre also, I started taking agad mga prenatals ko na vitamins na according to my doctor, I really needed. Obviously, DHA, iron, iodine, vitamin D, kasi kulang ang mga Filipino sa vitamin D, di ba? And of course, yung folic acid during the first trimester. And so snacking on Aptamom cereal bars kasi it has all the nutrients na my OB was recommending. So that's what I did when I found out I was pregnant. Pero Doc, gaano ba talagang ka-importante to make sure that you have all these nutrients during pregnancy?
Lara, from the start, even before you get pregnancy, kailangan you should be healthy already, living a healthy lifestyle and a well-balanced diet. Because I know you've read about this, na yung health mo during adult life depends on the health of the baby while still in the womb of the mother. Because nutrition, even stress, can affect the genetic makeup of the baby. And that predisposes you na for adult diseases like hypertension, diabetes. So as early as while still in the womb and while planning to get pregnant, you should have a healthy, balanced diet. Okay? And that consists of vegetables, fruits, anything that colorful in your diet. Okay? Avoid coffee, anything with caffeine. Even smoking can cause problems with the baby. So healthy lifestyle, stress. I quote, that your personality during pregnancy may also influence the personality of your baby. So if you're happy all throughout pregnancy, tendency you have a happy baby. If you're stressful all throughout pregnancy, then you might have a baby that's anxious, um, the attention deficit, hyperactive syndrome. So um, basically, when you're pregnant, you should be ready and you should accept that you're pregnant to have a healthy 9 months of pregnancy. And that includes a healthy, balanced nutrition. Not all the food that we eat, not all the food that we take in is enough to meet the dietary requirements. Remember, dalawa na kayo, you and your baby. So whatever you eat is what the baby gets. So you tendency is you have to eat for your baby. And if you have to eat for your baby, you have to eat nutritious food. Now, the food that you take, hindi siya enough eh. So you have to supplement yourself. And usually the one that we give you, the one with prenatal multivitamins, the folic acid, vitamin D, iron, iodine, DHA, and even calcium are supplements that your body cannot store and produce. That's why you have to eat and we have to supplement and give you additional nutrition. Diba? And that Aptamom is a snack. Okay? You can replace it with you can bring it anywhere. You can replace your snack with one cereal bar of Aptamom. And Lara, Aptamom contains the nutrients that's needed: folic acid, vitamin D, iron, iodine, and the DHA. Folic acid, di ba even before you get pregnant, dapat naka-maintain ka na ng folic acid. It is to prevent birth defects of the brain, even cleft lip, cleft palate, pwede niya ma-prevent, preeclampsia or hypertension during pregnancy, and even anemia during pregnancy. The vitamin D naman is for bone and teeth development of the baby. It also may help with preeclampsia and increasing your immune system. The iron is to prevent anemia, maternal anemia. So if your anemia is addressed with support of iron, then there would be better blood supply to the baby, creating a healthier baby. Iodine naman, although we use iodized salt is enough in our diet to prevent hypothyroidism. Hypothyroidism is problem in the thyroid, which can cause brain development, low IQ for the baby. So that would help a lot to bring up the mental ability of our babies. And then the DHA. DHA is omega-3. Omega-3 or fish oil. Okay? It's very good. This is my love. Love ko ang DHA talaga because it causes brain and eye development for the baby. So they have greater memory retention, memory grasping, and also fine motor skills and eye development is far more advanced compared to other children without the DHA.
Kaya, it's so much better when you have a snack that has everything in it, diba? Kasi it's easier to eat, diba? Like what you said, you can bring it everywhere. Katulad nga yung Aptamom that I have, that I snack on. It has everything and it's easier. Kasi tas may mga mommies akong mga friends na talagang tamad minsan uminom ng mga prenatals nila or parang they feel that it's not needed. So, it's really good that we have this kind of snacks available now compared before.
You're right, Lara. You're doing good. You're taking good care of yourself and also your nutrition. That's why you'll have a healthy baby. How do you manage your pregnancy with 2 kids in tow?
Yeah, kasi minsan, di ba, pag sinasabi nila kapag, succeeding pregnancy na, third pregnancy ko na, siguro, ka na, expert ka na. Pero hindi, iba pa rin talaga. Kasi obviously with my first, everything was new. Tapos with my second, meron naman akong panganay that I had to take care of. Ngayon naman, third pregnancy, 2 na yung inaalagaan ko. And, yung huli pa is really still very small and very clingy. So medyo nakakaano pala talaga. Akala mo pwede ka lang matulog-tulog, pero syempre, mommy duties doesn't stop. Kaya, may mga question ko to sa mga mommies na nanonood. Baka meron diyang mga mommies who have multiple kids, 2 or more. Share nyo naman yung tips nyo or may advice ba kayo how you handle ang maraming mga anak. Tapos buntis pa kayo. If you could comment in the comment section, I'm sure maraming mommies would appreciate advice and tips on how to handle maraming kids. Kasi now, Doc, yung second ko is very, very clingy talaga. As in, gusto niya kahit pag natutulog, nakaharap ako sa kanya. Gusto niya laging nakakapit sa akin, gano'n. So, it's really, really very difficult. Ikaw ba, Doc, anong tip mabibigay mo sa akin?
Every pregnancy is different. Every child is different. So, kailangan marunong ka mag-multitasking, marunong ka mag-adapt to each of your children. Kasi iba-iba sila eh. And one more thing. How old is your second? How old is your second?
He's turning 2 this September.
So clingy talaga. He knows you're pregnant and there's a baby coming.
Yeah, I would tell him, there's a baby in mommy's tummy. That's your little brother. You're going to be a kuya. Do you want to say hi? He would say, hi, baby. Ganyan. Pero pero sasabihin niya, mommy, Tobias, kasi tawag niya sa sarili niya, Bias. His name is Tobias. Bias, baby, mommy. Papakalo siya sa akin na parang baby. So, very baby pa.
Allow them to talk to your baby kasi your baby would recognize the voice also of your children. So pag nag-give birth ka, ma-recognize ni baby yung voice nila eh. And I have a tip for you. When you deliver, when you go home, you bring a little gift for the kuya and Tobias, explaining them that it's from your third, para they will love your baby.
Yeah, nag-prepare na kami ng husband ko ng gift niya para lang ma-feel nila na kunwari love sila nung bunso nilang kapatid kahit wala pa namang kamuwang-muwang sa buhay. Just a little something. Idea yon.
That's right. How are you now during this pandemic? Are you on quarantine? Nasa bahay ka lang?
Nasa bahay lang. Yeah, but I'm thankful daw kasi, di ba, syempre marami talagang nangyayari. But I'm really thankful in a way kasi this is the only time na buntis ako na nakapahinga ako na nasa bahay lang talaga ako. Kasi with pregnancies, I was really working, lalo na yung last pregnancy ko, parang manganganak na lang ako, hindi pa ako tapos mag-taping. So, this time talaga kahit paano, at least I could spend time with the boys. So, getting rest pa rin talaga. Pero I'm sure, Doc, marami rin questions yung ibang mga mommies na yung mga issues na pinagdadaanan nila during this time. Meron bang mga parang pare-pareho kang naririnig na mga questions or issues from mommies, na mga pasyente mo ng mga mommies?
Of course, lahat naman kayo natatakot eh. With this pandemic, hindi mo alam what we have asymptomatic positive pregnant patients. You don't know who you're dealing with. I just reassure them. And then I'm always support them if they have questions. Nandiyan naman ang Viber. Most of the times I answer them. You just have to show them that you're there, you care. And when they know you're around, di ba, mas kampante ka.
Iba talaga yung merong support from the doctor, from your friends, your family. Ako, Doc, may question pala ako. Kasi recently lang, I was diagnosed with gestational diabetes.
Mm-hmm.
Well, sabi ko sa doctor ko, baka anomaly yan, baka false positive. Kasi birthday ng asawa ko the day before ako nag-take ng ng glucose tolerance test. So ngayon, my sugar has been monitored. Pero, is Aptamom, the Aptamom or cereal bar, is it still advisable for me? Pero kasi, Doc, also, I take it in between lunch and dinner for my snack. And I usually monitor my glucose. Okay naman siya. It's well below the limit.
That's why it will not cause any problem with your monitoring of your blood sugar.
Namang dalawa, mababa naman yung sugar ko eh. Kasi yung husband ko po police, diet police eh. So, siya yung nagbabantay ng kinakain ko since na-diagnose ako. So, minsan tatakas pa ako. Feeling ko pwede naman kasi okay naman yung sugar, ganyan. Wag lang sabay, pinaghihiwalay ko lang sila ng kain.
Na wag lang mapababayaan yung blood sugar level mo.
Eh, Doc, after naman pregnancy, so malapit na akong manganak. Is it still okay to snack on Aptamom? Will it still be beneficial to me and the baby? Kasi obviously, I breastfed my 2 boys. I'll be breastfeeding again.
Yes, of course. Remember, what you eat also comes out of the breast milk. So if you get additional nutrient and supplement from Aptamom, then the benefit will be there. So whatever you eat is what you breastfeed to your baby. Sometimes nga, di ba, if you eat a lot of sweets, tendency is your baby become sweet tooth also. So you should also eat even, especially after breastfeeding, during the breastfeeding time period, you should eat a variety of nutritious food also. So kung vegetables, your baby usually has the taste for or would like vegetables also. Diba?
Totoo yan. Kasi mahilig ako sa matamis eh. Ako mahilig din sa matamis. Pero feeling ko ngayon hindi na masyado. Kasi I had to kailangan magbawas this time around.
Remember when you deliver, you lost blood. Diba? You lost some blood. So you have to build up your iron levels again. So you have to continue your iron. Number 2, you're breastfeeding. So you need extra calcium for you to also to supply the baby. So you have to continue your calcium supplement as well. DHA, you don't eat enough of the enough salmon, enough fish to maintain the level of DHA in the blood. So you have to supplement also yourself, especially if you are breastfeeding. So you have to continue everything, what you're taking, you have to continue everything.
Oo nga. Kasi may mga mommies akala nila pagkapanganak, okay na, tapos na. Diba? Pero yun nga, like what you said, tuloy-tuloy lang yan eh. Doc, I have a question naman. Does our affect how we feel? I don't know if it has any connection.
Which one?
Or, obviously when you eat healthy, will that affect how you feel? Kasi di ba may mga mommies who experience mga depression, postpartum depression. Even during pregnancy, they would experience parang, pregnancy blues, if you call it that. So, does, the way you eat, does it affect that? Kasi diba sabi, pag kumain ka palit, sasaya ka. So, mga ganun.
Yung pregnancy blues, that is just temporary. Yun yung iyakin ka after delivery when you cannot cope with the stress of taking care of your baby. You have too much on your hand, iyak ng iyak. Sometimes you really are stressed because of because of the situation. That's why I experienced the pregnancy blues. But it would last only for a few days. And usually you observe it on the 4th or 5th day. And then it disappears within a week. Compared to a depression would last longer. And with depression, you're not able to take care of yourself, more the baby. Ayaw mo nang alagaan yung baby mo, parang you're giving up. That is already a depression. And with depression, you need psychological support and also maybe an antidepressant. And consultation with a psychiatrist for that. But for pregnancy blues, it's just temporary. Sometimes really, my moms experienced this one. And you just need to support them and reassure them that everything is okay. Plus the fact that yung husband mo or even your family should be supportive of you. Para maiwasan yung anxiety associated and stress associated with taking care of your baby.
So,
Diba?
kailangan overall, di ba, what we eat, how we rest. And siguro, Doc, I'll share lang din with all the mommies who are watching na, who may be experiencing the same thing. Kasi, we tend to compare, di ba, yung mga itsura natin sa mommies. Lalo na pag nakikita mo yung mga iba na bakit sila parang hindi naman buntis, ang sexy pa rin. Kasi ako, that's how I've been feeling every pregnancy. Hindi na ako nasanay. Sabi nila dahil boys daw, kaya ganun. Pero hindi naman. Kasi may mga mommies din na girls yung anak, pero maitim yung mga leeg, maitim yung mga hili. So, pag nakikita ko talaga yung sarili ko, yung parang, alam mo yun, hindi mo ma-avoid to feel, in a way, insecure, down. Kasi, especially when you look at the other pregnant moms or kapag naalala mo yung itsura mo dati, na ang puti mo, ang kinis mo, and then suddenly you see yourself with all these mga marks, mga parang uleng, ganyan. So, to all the mommies who are watching, I think, Doktora, you can let me know if I'm wrong. It's normal for mommies talaga to experience these changes, di ba? Iba-iba. Some of them, okay naman yung skin, but for most moms, marami talaga sa atin ang nakaka-experience ng pagbabago sa body, and we shouldn't dwell on that kasi it will pass, 'di ba? Ganong katagal ba, Doc, after mga anak mawawala tong mga itim sa mga kilikili ko tsaka leeg?
Usually, it improves 6 to 8 weeks. And these are all secondary to the hormones of pregnancy. Even the hair fall, you'll experience hair fall after delivery. Just let the 8-week mark pass and everything will improve. Lara, I also believe it's your outlook in pregnancy. Yes. So if you are happy with your pregnancy, even the way you look, it will affect the way you look, the way you think, and stress. Don't read too much. If you read too much,
Don't
especially those, yes, don't Google too much. Kasi especially those mga horror stories of pregnancy, it will never help you. Kasi every pregnancy is different. So, just sa akin you just have to trust your obstetrician. We're there to help and guide you. And of course, kami naman ang gusto namin is for you to have a healthy pregnancy and a healthy baby. Once you're 36 weeks, are you ready na for your delivery?
I haven't had the swab test pa, Doc, kasi ngayon, maybe for those who are about to give birth, then the mommies would like to find out, we have to have, di ba, the COVID test before giving birth. Otherwise, we will be placed in a COVID area. Tama po ba, Doc?
Every hospital has different protocol, but usually we divide patients with those without COVID and those with COVID. So rest assured, during your delivery, if you are COVID negative, your delivery will be in the clean area. But if you're COVID positive or suspect or high risk for COVID, then you will deliver in the COVID area.
But what happens if you have like an emergency CS or kailangan mo ng mga anak without your result pa? What will happen?
If you don't have the result, you'll be high risk for COVID. You will deliver in the COVID area, but of course, we have the infectious to assess you. If you're not high risk for it, then usually they transfer you to the clean area after.
Kasi I'm sure yan yung mga fears ng mga mommies ngayon who are about to give birth, di ba, during this time na is it safe, di ba? Or paano mangyayari kapag ganun? Kasi ako yan yung mga fear ko na dahil nga scheduled pa ako for CS in 3 weeks, almost 3 weeks pa. What if I contract or labor before then? Hindi pa ako nakakapag-test. So, yeah.
It depends on the hospital. The result comes out 24, 48 hours. And they give priority for pregnant kasi. So, they do the tests for pregnant patients so you get the result earlier compared to others, diba? But it's safe to deliver now. Di naman siya tumigil, Lari. Our work as obstetricians, tuloy-tuloy kami even with there's pandemic. So because kailangan mag-deliver ng mommies, diba? That's why we have devised and reconstructed the delivery room to allow mothers to deliver in the clean area who are COVID negative. Don't worry too much. Everything is okay.
So mga mommies na manganganak pa lang, don't worry daw too much. Yeah, just pray and everything will be okay, hindi ba, Doc?
After delivery, mabilis na namin pinauuwi yung mommies eh. So, with normal delivery, usually 24 hours, pinapauwi na namin. With cesarean section, 48 hours, pinapauwi namin. So, when you deliver, Lara, lakad ka na kaagad after 6 to 8 hours. Try walking so you can go home kaagad.
That's right. Oh, CS ako, third time CS this time again. So, yun nga yung sabi din ng mom ko na kapag kahit CS ka, if you can try standing up, moving na a little bit para wag daw ibigay yung pain. So, that's good to know that we have to stay naman in the hospital for long kahit CS din. Pero Doc, bawal na talaga yung mga husbands in the delivery room, hindi ba?
Yes. Bawal na. We're limiting the people inside the delivery room, and that is to prevent COVID. Diba? Maraming asymptomatic na positive eh. That's so why we're limiting the people.
Kailangan din ba yung mga husbands to take COVID tests? Or is it just the mom who are required to?
Depends on the hospital. Actually. Oo. In one of the hospitals, the husband and the mom, parehong may COVID, required ang COVID test. In another hospital, it's just the mother or the pregnant patient which requires a COVID result. Okay? If you want to be sure, or your husband wants to be sure, kasi mag-aalaga din siya ng baby, they can do COVID test para siguradong, negative.
So, pagkapanganak, Doc, hindi naman namin kailangan mag-quarantine ni baby pagdating sa bahay?
Actually, no need. You just have, kasi you'll be breastfeeding eh. No need to be quarantined. You'll be delivering in the clean area, so everything will be okay.
Safe naman for the other kids naman. Pagdating na lang ligo agad sa bahay siguro.
Yes. Yes.
Kasi ako, kaka-prepare ko lang actually ng hospital bag ko eh. Kasi feeling ko the other night, parang feeling inigas yung tiyan ko. So, feeling ko lang naman, baka napaparang ako. So, inimpake ko na agad yung hospital bag ko. Ano ba yung mga essentials during this time na we need to add to the hospital bag na you can suggest? Ako, importante talaga mga mommies, may dala akong plancha, tsaka blower. Kasi, syempre, pag pinicturean, syempre yung first picture kasama yung baby, dapat maganda yung hair mo. Kahit pa paano. Kasi naka-ano pala, no? Naka-hairnet ba?
Naka-mask ka rin eh.
Oo, naka-mask. So, hindi na pala kailangan mag-lipstick. Pero yun yung plancha, blower, makeup. Yun yan. Pero during this time, Doc, what else can you suggest that we should have in the hospital bag?
Okay. Everything that the baby needs. So, yung susuot ni baby, the going home attire of the baby. Since you're breastfeeding, you don't need to bring anything kasi you'll be direct feeding. So, that would be enough. Naman for you, not much. Kung ano yung the things that you're gonna wear, maybe extra diapers or extra sanitary napkins, that would be enough.
Pero Doc, so ngayon na with everything that's happening, do you have any more advice for mommies? Kasi importante talaga, like what you said, the first 1,000 days ng life ng anak natin, apektado na yan all throughout their life, di ba? So what else can you advise you? Or may mga questions by mga patients mo that they would usually ask about this? You know, hindi lang for the babies, but even for the mommies.
Yung first 1,000 days covers the preconception. So from maybe the time you get pregnant until 2 years old. So that's the very critical period for the baby, for your child. Kasi doon the nutrition, again, nutrition is very essential. Number 2, the stimulation to increase the intelligence of your baby. Kasi para siyang yung first 2 years of life niya, doon nag-absorb lahat yung brain niya is a sponge, okay? And it's during the 2 years, that's a critical period where you can teach your baby anything and everything that stimulates the brain. You have an intelligent, high IQ baby. So ideally, during the first 2 years, during pregnancy and 2 years, again, very essential ang nutrients, healthy, balanced diet and activities, and less stress. Outlook should be happy. You should always be happy. Para you have good pregnancy and a healthy child.
Yeah. So kailangan talaga we shouldn't worry about things that are beyond our control, mga mommies, di ba, Doc? Kasi it's not gonna help us at all. At saka, our children will always be worth it. Okay, thank you, Doc, for this time. Ang dami kong natutunan, and thank you for all the advice para sa ating mga mommies na nanonood.
Yeah. Thank you too. Thank you for giving me this opportunity. Lara, it's so nice to meet you. Yeah. I'm praying for a safe delivery and healthy baby for you. Also, I'd like to thank Nutricia for giving me this time to share everything about pregnancy. Remember, mommies and mommies to be, to always be healthy and always be happy during pregnancy.
Yeah, thank you, Dr. Ces. Sobra, we are really grateful. And of course, we are also thankful to Nutricia for giving us, this kind to conduct webinars like this, because this really is very helpful to all the mommies to be, and even the mommies who are watching, even the daddies na rin. Kasi this is really a proactive approach when it comes to health and nutrition. And, Nutricia is someone we can really trust kasi they have been around for more than 100 years, diba? 120 years to be exact. And they have been in the forefront as early life nutrition experts. Kaya we can really trust that they know what they are doing, that they know what they are talking about. So thank you so much to Nutricia. Thank you, Dr. Ces. And of course, grabe, I would really recommend to all the moms. Actually, I have ready na ako kasi nararamdaman ko malapit na ako magutom. So, ready cereal bar. To all the moms, especially if you have a lot of kids, it's really, really, really easy to just have a snack that has everything that you need, anytime that you need it, especially when you're busy, that you can just snack on Aptamom cereal bars. So yan, favorite yan. At pwede pa sa atin mga may GDM. So thank you so much, Nutricia. Thank you, Dr. Ces. And to all the moms who are watching, if you have any comments, if you have any questions, just write it down in the comment section. And, you can also send your questions to the Nutricia Care Line. And if you follow us on Instagram, the Nutricia FB page and the Aptamom IG page as well, and even Facebook page for motherhood tips and advice, marami kayong makikita dyan ng mga tips and advice for us mga mommies to be and mga mommies in general. So just follow us on Facebook and Instagram, and that's Nutricia Philippines on FB and Aptamom PH on IG for more motherhood tips and advice. Anyway, thank you, Dr. Ces. Super had a great time chatting with you.
Yes. Thank you, Lara.
Thank you to all the moms. See you.
Bye, everybody.